Are you sad about losing your job, or are you clinically depressed? There's a massive difference, and knowing which one you have determines whether you need a therapist or just time. Get this wrong, and you could suffer for years unnecessarily.
Here's what's at stake. Sadness needs support and time. Depression needs medical intervention. Treating depression like sadness means it gets worse. Treating sadness like depression means unnecessary medication. You need to know which you have.
In the next 10 minutes, I'm giving you a side-by-side comparison, a self-assessment checklist, a week-by-week tracker, and clear decision points for when to seek help. This is your diagnostic toolkit. Let's get started.
Here's the problem. Everyone uses the word depressed casually. I'm so depressed about losing my job. But clinical depression is a specific medical condition with specific criteria. Most people don't know the difference, so they don't get the help they need.
Today you're getting side-by-side symptom comparison, the 9 criteria depression checklist, week-by-week tracking system, clear seek help now red flags.
Let's start with the side-by-side comparison. I'm going to describe 8 key differences. Keep count of which side sounds more like you.
Comparison 1. Duration. Sadness comes in waves. Some days are hard, some days are better. Crying spells happen but pass. Bad moments, not bad days. Depression. Persistent most of the day, nearly every day, for at least 2 weeks. No relief. Even good things don't help. It's constant.
Comparison 2. Emotional range. Sadness. You can still feel other emotions. You laugh at a funny video. You feel grateful when someone helps. You have emotional variety. Sadness is just dominant. Depression. Emotional flatness. Nothing feels good. You watch comedy and feel nothing. Numbness. You're emotionally one note.
Comparison 3. Response to positive things. Sadness. Good news lifts you temporarily. A friend's encouragement helps. Small pleasures still work. Good food, sunshine, a walk. You're responsive. Depression. Anhedonia. The inability to feel pleasure. Good news doesn't register. Nothing helps. Your reward system is offline. Complete non-response.
Comparison 4. Self-perception. Sadness. I lost my job and I'm sad about it. External event causing internal response. Your self-worth is bruised but intact. Depression. I am worthless. I am a failure. I am a burden. Distorted negative beliefs about your core self. You generalize to your entire identity.
Comparison 5. Sleep. Sadness. Sleep is disrupted but functional. You have some bad nights. You can nap. When you sleep, you rest. Depression. Insomnia for hours every night, or sleeping 12+ hours and still exhausted. Sleep never refreshes you. Your sleep architecture is broken. Comparison 6. Physical energy. Sadness. You're tired, but you can do things. Showering, eating, leaving the house. Hard, but possible. You function, just slower. Depression. Psychomotor retardation. Moving feels like walking through concrete. Showering is impossible. Getting off the couch requires enormous willpower. You're physically stuck.
Comparison 7. Future outlook. Sadness. This sucks, but I'll get through it. Hope exists. You can imagine feeling better eventually. Depression. This will never end. I'll always feel this way. There's no point. Hopelessness. You literally cannot imagine feeling different.
Quick assessment. Which side sounded more like you? If you're mostly on the depression side, keep watching. We need to go deeper. Now let's get clinical. The DSM-5 has 9 specific criteria for major depressive disorder. You need 5 or more, present nearly every day, for at least 2 weeks, with at least 1 being criteria 1 or 2. Let's check.
Criterion 1. Depressed mood most of the day, nearly every day. Feeling sad, empty, hopeless. For adults, this can be irritability instead of sadness. Ask yourself,
Is my mood low or irritable almost every day? Check yes or no.
Criterion 2. Loss of interest or pleasure in all or most activities. Things that used to bring joy don't anymore. Hobbies feel pointless. Ask yourself, have I stopped enjoying everything? Nothing feels good? Check yes or no. Criterion 3. Significant weight change, 5% body weight in a month, or appetite change daily. Either direction counts. Ask yourself, have I lost or gained significant weight unintentionally? Is my appetite drastically different? Yes or no?
Criterion 4. Insomnia or hypersomnia nearly every day. Can't fall asleep, can't stay asleep, or sleeping way too much but never rested. Ask yourself, is my sleep severely disrupted every night? Yes or no?
Criterion 5. Psychomotor agitation or retardation. Either you're physically restless, can't sit still, or you're moving in slow motion, observable by others. Ask yourself, am I either extremely restless or extremely slowed down physically? Yes or no?
Criterion 6. Fatigue or loss of energy nearly every day. Not just tired, profound exhaustion. Everything requires enormous effort. Ask yourself, am I exhausted no matter how much I rest? Yes or no?
Criterion 7. Feelings of worthlessness or excessive guilt nearly every day. Not realistic guilt, distorted, excessive self-blame. Ask yourself, do I feel like a worthless person or blame myself for everything? Yes or no?
Criterion 8. Diminished ability to think or concentrate, or indecisiveness, nearly every day. Can't focus, can't make simple decisions. Ask yourself, can I barely concentrate or make decisions anymore? Yes or no?
Criterion 9. Recurrent thoughts of death or suicide. Not just, I wish this would end. Actual thoughts about dying or plans to die. Ask yourself, am I thinking about death or suicide? If yes to this one, you need help today. Call 988. Count your yes answers. 5 or more, with at least one being number 1 or number 2 for at least 2 weeks. That's clinical depression. You need professional evaluation, not just self-help.
Now, here's a productivity tool, the week-by-week tracker. Use this to monitor whether you're moving toward depression or recovering from sadness. This is how you catch depression early.
Week 1 after job loss. Rate these daily on a scale of 1 to 10. Mood, 1 being terrible, 10 being great. Energy level, sleep quality, ability to enjoy small things. Normal pattern, scores are low but vary day to day. You have some 4s and 5s mixed with 2s and 3s. Warning pattern, scores are 1 to 3 consistently with no variation. Weeks 2-3, same daily ratings plus track. How many times you smiled or laughed, whether you left the house, whether you showered. Normal pattern, scores start improving slightly. You have more good moments. You're functioning, even if sad. Warning pattern, scores staying flat or dropping. You're showering less, not leaving house. 0 smiles. Week 4. This is your major checkpoint. Add these questions. Can you still feel hope? Do you still believe this will end? Are you having thoughts of death? Normal pattern, rough days exist, but overall upward trend. Hope is present, even if faint. Warning pattern, scores not improving after a month. Hopelessness setting in. Death thoughts emerging. This is your red flag. Weeks 5 to 6. If you're still struggling, track. Number of hours you can't get out of bed. Days you can't complete basic tasks. Whether symptoms are interfering with job search. Pattern. If symptoms persist into week 6 with no improvement, you meet the duration criterion for depression. You need professional evaluation now.
Take this tracking data to a doctor or therapist. It's evidence. It shows pattern, duration, severity, makes diagnosis faster and more accurate. This tracker is your most productive tool.
Red flags that mean seek help now, not next week, today.
Flag 1. Any suicidal thoughts, plans, or urges. Call 988 immediately. Flag 2. Unable to care for yourself. Not eating, not drinking water, not getting out of bed for days.
Flag 3. Can't function at all. Can't apply to jobs, can't respond to calls, can't maintain hygiene. Complete shutdown. Flag 4. Getting worse despite time passing. Week 4 is worse than week 1. Trajectory is downward, not stable.
Flag 5. Self-medication. Increasing alcohol or drug use to cope. Substance use changing your behavior. Flag 6. Withdrawal from everyone. Not answering anyone. Complete isolation for days, weeks. Rule: if you have even one of these red flags, depression or not, you need help today. Don't wait for a diagnosis. These are medical emergencies. Here's your decision tree. Follow it. Under 2 weeks of symptoms plus functioning plus hope exists equal monitor with tracker. Try self-care. Give it time. 2 to 4 weeks plus symptoms worsening plus life impaired equals schedule therapy evaluation. Don't wait. 4+ weeks plus 5+ criteria plus no improvement equals schedule psychiatric evaluation. You likely need medication plus therapy. Any red flag at any time, emergency help today. Simple, clear, follow it.
Can I share something personal for a second?
I spent 8 weeks thinking I was just sad about unemployment. I kept telling myself, this is normal, give it time. But my tracker would have shown me, week 1, 2, 3, 4, 5, 6, 7, 8, all flat at 2 out of 10. No improvement. That's depression, not sadness. When I finally got evaluated at week 10, doctor said, you've had depression for 2 months. Why did you wait? I didn't know the difference. If I'd had this video, I'd have gotten help at week 4.
Use these tools. Track your data. Don't assume it's just sadness. Depression is sneaky. It makes you think it's normal. These tools tell you the truth.
Let's recap your productivity toolkit.
Side-by-side comparison. Sadness varies, responds to good things, has hope. Depression is constant, no pleasure response, hopeless. 9 criteria. Need 5+ including depressed mood or anhedonia, lasting 2+ weeks.
Week by week tracker. Rate mood, energy, sleep, pleasure daily. Normal is variation and gradual improvement. Depression is flat low scores for weeks. Week 4 checkpoint. If no improvement, seek evaluation.
Red flags. Suicidal thoughts. Can't function. Getting worse. Self-medicating. Complete isolation. Anyone equals help today.
Decision tree. Under 2 weeks equals monitor. 2 to 4 weeks worsening equals therapy. 4+ weeks plus criteria equals psychiatry. Red flags equals emergency.
I know this is scary. You're trying to figure out if what you're experiencing is normal unemployment sadness or something that needs medical treatment. That uncertainty is exhausting. But now you have tools. You're not guessing anymore. You're tracking data. Data removes uncertainty. Your tracker will tell you what you need to know. Trust it.
And if it is depression, here's hope. Depression has an 80-90% treatment success rate with proper intervention. Therapy works, medication works. You can feel better, but you have to recognize it first.
Most people start feeling better within 4 to 6 weeks of starting treatment. Not cured, but noticeably better. That's the light at the end. You just have to recognize what you're dealing with.
Sadness needs support and time. Depression needs treatment and time. Either way, you need time. But depression needs one more ingredient: intervention. That's the only difference. You're not alone in figuring this out. Hit like if this gave you clarity. Comment which tools you'll use: the comparison, the checklist, or the tracker. Your comment helps others know what works.
Until then, start your tracker today. Track for 1 week. Let the data guide you. This is MindStick reminding you, you don't have to guess. You can measure, monitor, and make informed decisions.
See you next time.